Good morning, everybody. Or actually, I'm sorry, it's afternoon now. Chris Gant Sorensen with Hainsworth Sinclair Boyd, and we're glad that you are joining us for this very important webinar. Demetrius Pyburn is going to talk to everyone about the most common OSHA sightings in regards to COVID-19 so that employers can do a sort of an audit, an internal audit, and make sure they're good to go so that they can avoid the similar citations. And he'll talk to you, there's a number of them, but he's culled them down to the most common, and really looking forward to hearing his presentation. Just to tell you a little bit about Demetrius. Demetrius, and y'all heard us talk about this before, he's in the armed forces and he came to us from U.S. Army's Special Operations Aviation Regiment. And he was involved in aviation and logistics, and now he's in the reserves. And so he has got some great stories and some amazing experience. And of course, we're very thankful for Demetrius's service and continued service. And then he works with us on the employment law team. Very, very great employment lawyer, great addition to our team. He's been speaking with us on a number of issues. He also is for Sherm State Council, the director of the DEI efforts. And so in addition to that, he is approved litigator for aircraft owners in the Pilots Association. And just, he's got his fingers in everything. So glad that he'll be here today to talk to everyone about this. And I'm gonna pop on to the next slide, please, Brittany. If you have any questions, submit them in the chat like we always do. Demetrius will be busy presenting, so I'll be reading those, and there'll be times when we'll address your questions to him, and we'll make sure that they get answered. We will share the slides like we usually do. And a reminder, make sure that you are subscribing to our blog. This is how obviously you heard about the webinar, and that's where we keep you updated. And also we've got a number of COVID-19 resources on the HSB's COVID-19 page, not just employment law, but that is also where we post all of our webinars in case you had to step away and weren't able to finish. And we also post a bunch of different information and materials from our other partners in other areas of the law, all specific COVID resources for businesses. So, all right, well, with that, Demetrius, tell us about it.
Thanks, Chris. Welcome everybody to the Workplace Safety Seminar. I'm excited to be presenting on this topic with you this afternoon. I'll just get right into it. Employers across the country have dramatically changed the way they're doing business during COVID. As a partner with employers, government agencies had to change and adapt too, which would include OSHA. COVID made it necessary to work on plans to provide training and educational opportunities and compliance actions with OSHA, whether it be at the state or federal level. According to Christina Baker, South Carolina's OSHA's deputy director, SE OSHA has forged relationships with other government agencies and industry leaders to bring more awareness to employers about safety precautions needed to combat COVID. I wanted to outline in my introduction some of the efforts that South Carolina's OSHA have been doing in response to developing some best practices for industries re-entering the workplace, as many of you have been working on, if you haven't been working through as a frontline worker, working on the re-employment and re-entering of the workplace. Some of the efforts that OSHA has undertaken is providing webinars and training on safety precautions for employers and employees. They've also provided support and information to daycare centers, providing informational webinars to the nursing home industry. And I'll be touching a little bit on that because you're seeing a lot of violations as it pertains to the nursing industries, the nursing home industries and the healthcare industries. And I'll talk a little bit more about what they have been previously cited for, specifically about the respiratory programs. They've partnered with DHEC, South Carolina's DHEC, to address issues within the food service industries and provided interventions to restaurants and other food service industries to address public complaints and concerns. Along the lines of addressing those concerns with customers, they've been addressing complaints and concerns with employees concerned about their own workplaces, and to provide a platform to report their employers with regards to workplace safety. Since the start of the pandemic, federal OSHA and South Carolina's OSHA have been receiving those complaints and investigating the alleged violations of the standards. Let's start by discussing some of those results of the investigations by giving that 10,000 foot view. So, federal OSHA by the numbers. Every week, I would say from, I believe, June until January 8th, weekly, OSHA had been providing weekly press releases about citations that they have issued on workforces and businesses with regards to alleged violations of, or penalties based on violations of the standards. In each one of these releases, the OSHA provided the establishment's name, so they identified each business by name, the inspection number, the location of the business, and the initial penalty. There was a separate press release that housed all violations pertaining to COVID-related citations, which included the the standards cited. As you can see on this slide, there were 300 citations issued from the start of the pandemic to the end of last year, December 31st, 2020, with over $3.9 million in initial proposed penalties, which brings the average to $13,000 per initial penalty. And I have on the slide the ranges being, there's very few. I put the range, 0 was the lowest penalty. Not too many employers obviously received a $0 initial penalty, but that highest is not exactly correct. In October 29, 2020, there was a nursing home in New Jersey that was initially penalized $32,965. So the penalties ranged greatly, and it was based on the violations and the egregiousness of the violations, the amount of the amount of standards that were violated. We'll talk a little bit about those penalties as we go forward. The national OSHA, as I reviewed the 300 citations, none of those citations were assessed to a South Carolina business. That doesn't mean as South Carolina businesses were not investigated, it was just they were not cited by the federal OSHA and assessed penalties. Move to the next slide. OSHA initiated these inspections following complaints, referrals, or fatalities, and many industries were cited, but there was an overarching theme of the industries for which penalties were assessed, and those were hospitals and healthcare, nursing homes and long-term care centers, settings, and the meat and poultry processing facilities. There were other industries that were cited. There were a couple construction companies, there were a couple in other industries, but overarching themes specifically with the healthcare profession, the nursing homes, and the meat packing processing facilities. South Carolina, by the numbers, Christina Baker, who I spoke briefly about, wrote a letter in her press release in October, and the numbers that were provided were only from March to September. I was unable to locate updated numbers, but as of the end of September, there were over 1,400 calls received between the compliance and the standards programs. 948 complaints were referred to South Carolina's OSHA in that 6-month period related to COVID. I broke down, similar to how South Carolina's OSHA broke down between the compliance and the standards programs, the complaints received, the calls received, and I want to note that the calls received, they didn't start recording calls received until July. So there were calls being received April, May, and June, but they weren't being tracked as well as they were after July. So there were about 1,400 calls and 948 complaints received. In response, they resolved all in all 636 complaints. They sent 378 emails in total and referred 239 complaints. And they conducted 12 investigations during that time. Before I go further and discuss, Chris, did I get any questions yet? Okay. All right, let's talk about some of the citations. A good portion of this presentation is intended to help employers understand which OSHA standards have been cited most frequently during the COVID-related inspection. This data is based on the inspections where citations have been issued. Please note, to the best of my ability, these slides pretty much track the in order of the frequency by which these standards were cited. So as we go along and you see the slides, and as I proceed through these next 6 or so slides, please note that the slides in the beginning of this portion were the most cited standards of all the standards that have been cited over the last 9 months. They can really be broken down into 3 categories: the respiratory protection programs, the recording and reporting of occupational illnesses and injuries, and personal protective equipment. I would say that the respiratory protection program, I believe the top 15 or so standards that were cited came specifically from the respiratory protection program. And we'll talk a little bit about that next slide. I don't put the entire the regulation on the slide if it wasn't important, but I wanted to set the stage for the next few slides as we discuss the respiratory protection program. In the control of those occupational diseases by breathing air contaminated with harmful dust, fog, fumes, mist, gas, smoke, the primary objective is to prevent those atmospheric contaminations. This is accomplished by engineering controls such as ventilation, confinement of the operation, the substitution of less toxic materials. Also, the types of masks used are also ways that acceptable engineering control measures. When engineering control measures in the workplace are not feasible, appropriate respirators shall be used pursuant to the section contained 1904 and 1910, I believe. So I'm gonna spend a good portion. I wish I would have taken a poll to see the makeup of the professionals on as far as their industries, but the respiratory standards really were issued to nursing homes, a lot to construction, a lot to manufacturing, a lot to meatpacking. So the most cited standard was the top standard when it came to medical examinations. Employers did not provide medical examinations before workers were fit tested or used the respirators for the first time. That is the most cited standard. The second most cited standard was the one right below it. Medical evaluations were missing. There were missing information required by the mandatory OSHA respirator medical evaluation questionnaire that's provided in one of the appendices of the standard. The next 3 pertain to fit testing. Fit testing, the first standard was the employer did not perform a proper fit test of the respirators. The respirators, employers did not ensure that the employee were fit tested prior to use for the first time. They didn't ensure whether it was a different respirator face piece that were used. And I'm talking about not just the N95s that many people are familiar with, but maybe other types of respirator face pieces that were used, make, model, size, or style, and the fit test wasn't done annually thereafter as they made those changes, as the businesses use different types of respirators. Go back up one slide. Um, Employers were also not administering the fit test using the fit testing procedure standards that were outlined. Now, I do want to, before we go forward, discuss the COVID pandemic resulted in a public health emergency that dramatically increased the demand for these respirators, the N95 filter and face piece respirators, as well as, the fit testing supplies ordinarily used to ensure that the respirators fit workers properly and provide the expected level of protection. The shortages of both the N95s and the fit testing supplies posed a tremendous challenge, and OSHA recognized that challenge. In order to allow that essential operation to continue, many employers had to, have contingency strategies that they ordinarily did not comply with OSHA standards. Examples that I've heard were extending the use of disposable respirators, the decontamination and the reuse of disposable respirators, and the use of respirators from foreign entities that were not approved by the National Institute for Occupational Safety Health. In response to the shortages during COVID, OSHA issued several temporary enforcement guidances to allow the inspecting officers to exercise discretion in enforcement discretion when it considered issuing citations regarding the respiration protection standards. It's important to note that these temporary enforcement guidances didn't give a blanket waiver or an exemption to employers to comply with any of the standards. And as I discussed in this slide, many businesses were cited these respirator protection standards. They allowed for the enforcement discretion during the COVID pandemic periodically, only in circumstances where the employer demonstrated that it was unsuccessful, but they reasonably tried to obtain and conserve supplies for respirators and fit testing as outlined in the temporary guidance. So many of these businesses were not able to objectively show reasonable effort in complying with the standards, and they were just unable to do that. We can move to the next slide. So just the respiratory program in general, employers were not establishing, implementing, or updating a written respiratory protection program, and they were constantly being cited for that. Employers who were able to produce the respiratory protection program written policy oftentimes did not include specific provisions of the program, including procedures for the medical evaluations and fit testing, and they did not regularly evaluate the effectiveness of the programs. Employers were also required to provide employees with mandatory information from the employees using respirators while not required under standard. This was based on the second bullet point. Employers determined voluntary respirator use was not permissible, but didn't provide the employees with the mandatory information. They didn't designate a qualified program administrator to oversee the respirator protection program and conduct the required evaluations for the program's effectiveness. They also didn't provide training to the employees who were tasked to don these respirators. Each employee were required by the standards to ensure they understood why the respirators were needed, how the improper fit, use, and maintenance could reduce the protection, the limitations and the capabilities of the respirator, and how to use it effectively in emergency situations. When these inspectors were going to sites and discussing this with the employees were not able to display knowledge of those things. They weren't unable to demonstrate how to inspect, put on, and remove and check the respirator seals. May not have known how the procedures for storage and how to recognize the medical signs and symptoms that may limit or prevent respirators use by the employees. Employees were cited by not retraining Employers, were cited for not retraining when their old trainings were obsolete. They were not reviewing their programs and policies, and when the trainings were obsolete, revamping those trainings in order to retrain and reteach these employees some of the things I discussed a little bit earlier. Next slide. So a few more things about the most cited respiratory protection standards, the general requirements. General requirements, pretty much employers were not selecting I'm sorry. The National Institute for Occupational Safety and Health approved masks when they were providing these respirators to their employees. Employers who were not selecting appropriate respirators based on the hazards employees were exposed to. So employers were being penalized not just for not having respirators or not selecting certified respirators, but they were the employers who were not selecting the appropriate ones based on a hazard assessment were also being penalized. As I discussed earlier, the inspectors were allowed to exercise discretion, but did not have a blanket waiver given to employers to comply with the standards. Permissible practices where employers were not providing the approximate respirators to each employee when necessary. So not providing enough respirators to employees, that would be under permissible practices. Medical evaluations, not establishing adequate fit testing records, specifically is the medical evaluations. And maintenance and care, employers were not storing respirators properly in a way to protect them from damage, contamination, or deformity as far as the face pieces and the inhalation valves when applicable. Moving right along, that was the top 15 or so standards as it pertained to respirator programs. The next 2 or 3 violations that were cited the most pertain to the recording and reporting of occupational illnesses and injuries. As many of you know on this webinar, when it comes to work-related incidents, employers are required to report fatalities within 8 hours after the death of an employee as a result of a work-related incident. COVID also is also reportable to OSHA when an employee is hospitalized within 24 hours of a work-related exposure. And I know a lot of questions came up during the pandemic as far as, how do you determine whether COVID is work-related in order to report them? And OSHA did come out with some guidance to help employers evaluate that. When an employer has knowledge of an employee testing positive for COVID and in making that determination, the employer must talk to that employee about how he or she believed COVID was contracted, talk to an employee about his or her work and out of work activities that may have led to the contraction of COVID, and also evaluate the employee's work environment for potential COVID exposure. Consider other instances of workers in the same environment as that employee contracting COVID. They gave evidence where COVID is likely work-related versus not work-related. Some of those examples include several cases were developed among employees who work closely together, and there were no alternative explanations. Another example is an employee contracts COVID shortly after being in lengthy close contact with other customers or coworkers that were also confirmed COVID cases, and there's no other alternative explanations. Another example is an employee's job duties include having frequent close contact or exposure to the general public in an area with ongoing community transmission, and there's no other explanation. And the most important things that I've talked about is the and no other alternative explanation. That is the most important things to consider when you're evaluating whether or not COVID was work-related. Some of the other evidence that it may not be work-related is the employee is the only employee to contract COVID in his and her work area, or his or her job duties do not include having frequent contact with the general public, regardless of the rate of community spread. So we'll move on to the next slide. PPE, personal protective equipment. This one is specific to the healthcare sector. The first 3 bullet points, these citations under those 3 bullet points below, the first 3 were specific to the healthcare sector, involved face masks, face shields, and gowns. While PPE were cited, those citations occurred so frequently that I just wanted to focus specifically to those who are on the webinar here today and work in those sectors, the healthcare, the nursing home sectors. And those were the big ones that were violated. Other than the respiratory, they were also violated here in the PPE. The employers were not conducting the proper hazard assessments. They weren't properly documenting the performance of those assessments. And the employers did not provide, use, and maintain PPE in a sanitary and reliable condition. Something that under the PPE standards, employers did not give proper training. Those standards, that was more applicable to all industries, not specifically to the healthcare sector, that last training bullet point that I have on the bottom of this slide. New OSHA guidance. Before we move forward to new OSHA guidance, I see there might have been one question.
There is, Demetrius. The question comes from Elizabeth Krause, and she asks, is OSHA's temporary guidance regarding sanitizing and reuse of the PPE still in effect?
Yes, it's still in effect right now, the reuse of the PPE, and it's for the purposes of the evaluation of the evaluators. The discretion is still there for the investigators that come to workplaces, and as long as the employer is showing that they have made a reasonable effort to comply with the standards, that temporary guidance is still in place. Thank you for the question. I wanted to carve out enough time to discuss the new guidance. It just came down. I'll talk a little bit about that. This is pursuant to the executive order President Biden signed the day after he took office, giving OSHA 2 weeks to issue revised COVID-19 guidance, covering consideration whether emergency temporary standards are needed by March 15th. Just reinstate workplace safety reporting rules, making making public employer records of injuries and illnesses. Next slide. OSHA was required to broaden protections for all workers not ordinarily covered by OSHA standards. They were required to review the enforcement efforts by identifying short, medium, long-term changes that can be made to better protect workers, to ensure equity in the enforcement, conduct multilingual education outreach programs to advise workers of their rights alongside the DOL, and consult with states who have no OSHA to ensure public employee safety and health protections are being met. And what's funny is Perry and Chris touched on this in their last presentation. I hope that you all had the opportunity to watch it on January 28th. If not, it's recording is out there and available. But what's funny is they presented January 28th, 2021 about the that 2-week requirement, and OSHA literally came down with their guidance the following day after their presentation. So they may have been able to present, but I get the pleasure of presenting about the guidance that came down January 29, 2021. It was intended to inform employers and workers in most workplace settings to how to set up and identify risks of being exposed or contracting COVID at work, and to determine appropriate control measures to implement. There are separate guidance applicable to healthcare and emergency response pursuant to the CDC. And I believe I have some of those resources available at the end of these slides. There's guidance that's been provided pursuant to industry. That's not all the industries that were outlined in that OSHA COVID guidance. Those are just some of the ones that, the notable ones that I've outlined: agriculture, construction, the healthcare industry, the food service industry. There's guidances for these different industries when it comes to COVID. I think there's a lot to discuss when it comes to the guidance, the new guidance, and the difference between the new guidance and the prior guidance provided by OSHA. But there's been a large emphasis specifically on the employee's role in rights, specifically in what the workers needed to know about COVID protections. There's a direct quote from the new guidance that the most effective COVID protection programs engage workers and their representation in the program's development and implementation. Some of the notable points in that section, what workers needed to know, was the involvement of the employees in the employer's development of the COVID prevention program. The employees should be informed of the terms of the programs and the resources available to them. And it told employees should be told by employers the obligation not to retaliate against them for bringing up COVID-related concerns to the attention of the employer, the media, or the public, which is vastly different than what the guidance was previously. And I'm gonna spend the remaining portion of the presentation talking about the guidances and the best practices outlined by this program, this developing and the implementing of employee workplace COVID-19 prevention program. The guidance recommends, and I want to place emphasis on a recommendation. And I'm gonna tell you why that I want to emphasize the recommendations in a later slide, but they recommend several essential elements in a good COVID protection program. The first bullet point goes without stating: assigning a workplace coordinator who will be responsible for COVID-19 issues on the employer's behalf. Employers having that designated person to be the go-to person for employees, and then having that be known to the employees is something that was first and foremost, and I think that was intentional on the part of OSHA when they outlined this recommendation for an essential element for a prevention program. The next bullet point: identify where and how workers might be exposed to COVID-19 at work. This includes a thorough hazard assessment to identify potential workplace hazards related to COVID. The assessment's most effective when it involves the workers. That's why they place so much emphasis on the workers and the employees and their representatives, because they're often the people most familiar with the conditions they face in the workplace. The next bullet point, the next element that they discuss is identifying combination of measures that will limit the spread of COVID in the workplace. And this should include a combination of a combination of measures to eliminate the hazards. That may include, workplace policies that can include PPE, what we discussed earlier. They could prioritize measures from the most to least effective to protect workers from COVID, send sick people home, improving the ventilation where you can within your workplace, performing the cleaning and disinfecting of workplace, providing supplies for good hygiene, soap, water, etc. Those all are the combinations that OSHA is discussing here in that third bullet point, and identifying a combination of measures that would limit the spread of COVID. The last bullet point on this page, consideration of protection for workers at higher risk. Specifically, they focused in the guidance on older workers and also workers that may have disabilities or other health issues that place them at high risk for COVID. Where feasible, employers should consider reasonable modifications for the workers that were identified as high risk, who can do some or all of their work at home, either in a part-time or full-time capacity, or in a less densely occupied, better ventilated alternative facility or area in the office. Next slide. Establishing a system for communicating effectively with workers and in a language that I understand, that is directly in response to part of that executive order that was issued by President Biden as it pertains to having multilingual communications effectively about the workers' rights and the workers' roles in the elimination of COVID in the workplace. A best practice was to create a two-way communication system that allows workers to self-report if they're sick or been exposed, and that employers can use them to notify workers of that exposure or COVID closures, respectively. Ask workers to communicate possible COVID hazards in the workplace in a language they can understand and then can access. There's a lot more posters that are recommended to be posted around and in different languages, in Spanish or in other languages. And that determination is made by the population in the workplace. Spanish was the most important one, and I think that was a specific focus within the construction industry and other industries that had multilingual workforce, where a lot of the guidance and the policies were written in English, and the workers that were coming to work did not know their rights pursuant to OSHA and workplace safety. Educating and training workers on the COVID policies and procedures using a accessible format and in a language they understand, communicating supportive workplace policies clearly and frequently in the plain language of the workforce. That includes non-English language and American Sign Language, which was something that I found really interesting about the regulation, is they specifically identified American Sign Language or other accessible communication methods if applicable, trying to be all inclusive in the workforce and the education and the training of the workers on the policy. Employers should communicate basic facts of COVID, workplace policies, and some means of tracing which workers have been informed in when the tracing occurred. Another element of effective COVID policy outlined by OSHA was instructing workers who are infected or potentially affected to stay home and isolate and quarantine. And the big point in that bullet was to make sure that the absence policy that you have in your workplace is not punitive. Policies that encourage workers to come to work sick or when they've been exposed to COVID are disfavored. And so that's a cultural thing, and that's something that you may want to take a look in your COVID policies and the culture of the absence culture, and make sure that it's disfavored and it's encouraged that employees, encourage employees to identify and isolate and stay home if they're to prevent the transmission of COVID in the workplace. Minimize the negative impact of quarantine and isolate workers. Uh, Allow them to telework or work in an area isolated from others. No, I'm talking about isolated workers who show up to work sick. I'm gonna combine these two bottom bullet points. Allow them to telework or work in an area isolated from others. When that's not possible, allow workers to use the paid leave if applicable or if available, or consider implementing paid leave policies to reduce the risk for everyone in the workplace. I won't touch on the FFCRA. If you've gone to any one of the number of presentations or been reading articles over the last 7, 8 months, Chris and Perry have done an outstanding job discussing the FFCRA and the leave it's provided. So I won't touch on that. Just make sure you are educated on the FFCRA. Perform enhanced cleaning and disinfecting after people suspected or confirmed COVID cases have been in the facilities. Follow the CDC cleaning and disinfected recommendations when the facility is inspected or confirmed to have somebody who had COVID. That's on the CDC website. I won't go into too much details. Many people already know where to find those recommendations. Provide guidance on screening and testing. Of course, follow the state and local guidances and priorities for screening and viral testing in the workplace. If you have testing requirements in your business, you should warn the employees and the availability of testing options. Record and report COVID infections and death. I've gone into detail about the requirements and what in the citations portion, so I won't touch on that. Implement protections and retaliation and setting up of anonymous processes for workers to voice concerns about COVID-related hazards. Remember, employers may not discriminate against employees for raising a reasonable concern about infection control related to COVID to the employer's agent or other employees. There's also, they may not discriminate against an employee for voluntarily providing and wearing their own PPE, such as a respirator, a face shield, gloves, surgical mask. Make the COVID vaccination available at no cost to all employees. That is a business decision, and that is a recommendation from OSHA. And the last bullet point is not distinguishing between workers who are vaccinated and those who are not vaccinated. Workers who are vaccinated must continue to follow the COVID protection program and the protective measures that have been outlined by your individual business, such as wearing a face mask, covering our face covering, and remaining physically distant, because at this time there's no evidence that COVID-19 vaccinations prevent the transmission of the virus from person to person. As the CDC explains, experts need to understand a little bit more about the protections that the COVID-19 vaccine provides before deciding to change the recommendations on steps everybody should take to slow down the spread of the virus that caused COVID. Next slide. Other notable points that I want to outline in the OSHA guidance is there's a stronger focus on face coverings. It's the most notable difference, one of the many notable differences between this guidance and prior guidance from OSHA. Employers should provide face coverings to the workers at no cost, is a quote from the guidance. Employers must discuss the possibility of reasonable accommodations for any workers who are unable to wear or have a difficulty wearing face coverings due to a disability. Also, in workplaces with employees who are hard of hearing, employers should consider acquiring masks with a clear covering over their mouth for all workers to facilitate lip reading. That's another difference between the guidances. Consideration for all different types of workers. not just language barriers, but people with disabilities, really being inclusive on this guidance as opposed to prior guidances. OSHA has been very careful throughout this guidance to use the permissive words should rather than mandating everything. A lot of these are recommendations. The guidance states that it's advisory and informational and intended to assist employers in providing a safe and healthy workplace. The general duty clause, as the guidance notes, requires employers to protect their employees from recognized hazards, and COVID is clearly a recognized hazard. So not addressing these hazards in the workplace is not an option for the employer. I believe in the future where, we as working with our clients and working with employers will be at odds with OSHA's what exactly an employer must do to address the COVID hazard and to protect their employees adequately. I think that'll be the biggest contention when it comes to investigations of what is that mandatory versus what is recommended when it comes to penalizing and assessing citations pursuant to the standards. As is stated in the guidance, the executive order, there's a March 15th deadline for the temporary emergency guidelines, and the agency's inevitable emergency temporaries COVID standard will look a lot like the guidance, I believe, and include the requirements a lot like what we have here in the guidance. And the emergency temporary standards will be enforceable without reference to other OSHA standards or the general duty clause. I believe we'll see something about that in the upcoming weeks. So it might be a little bit more guidance in the future, and there be a follow-up article I would anticipate on the topic when that guidance comes down close to that March 15th, if they even believe that there is a requirement or a necessity for an temporary emergency standard. So what I wanted to provide over in the last couple slides are some of the resources that you can take a look at, some of the articles provided by OSHA and the links to those publications. We have, if you go back to the last slide, I believe there's a poster that's also, go up a slide, is that the first slide? Oh, I believe there's an OSHA poster, bulletin, there's a guidebook, fact sheets, and e-tools assisting with the respiratory standards. Some of these later ones, August of 2020, they're still there. 7 steps to correctly wear a respirator at work, posters to display in your workplace, not a requirement, recommendations, but something to educate your employees on how to don their respirators properly. The medical questionnaires that I've discussed, the info sheet midway down the page, also a great help, a lot of checklists. Next slide. Fit testing for quantitative fit testing information in 2020. Next slide, nursing homes, assisted living. That's a great help for those out there that are in those industries. The enforcement guidance for respiratory protection right up top on this third slide, that is the temporary guidance for the shortage. That is where you could take a look at the objective reasonable standard that they gave to their investigators in order to evaluate whether or not to cite the standards for employers who are trying to comply, and what considerations they gave to their investigators. Go up one more, I believe midway down the page, there was also the expanded temporary enforcement guidance, April 8th, 2020. And the enforcement guidance, decontamination of the filter, face masks, respirators during the COVID-19 pandemic. So all those still available. All those resources are there for your education and view and pleasure. Next slide. a little bit more resources available for the reporting and recording of occupational injuries and illnesses. Those are all going to be hyperlinked links that you can just click on and go straight to, whether it be OSHA or CDC's guidances, PPE as well. A few more links available. Next slide. All right, we can go back. Trying to monitor to see if there's any more questions. I see there's not any questions. We'll just go ahead and move forward. Like to save our date for our March employment webinar. Wanted to announce that on March 25th at noon, Chris Gant Sorensen, who introduced me, and Mac McLean will discuss representation of employers before the DOL, Employee Benefits Security Administration, in their investigation of employee benefit plans, providing cautionary tales and tips for employers for compliance. So if you haven't already done so, please RSVP and don't miss out on this outstanding program with Chris and with Mac.
If I may, I'll jump in, Demetrius, if you don't mind. The actual official title of the seminar is Correction Programs of the IRS and DOL for Plans. And Mac and I have worked on, for clients, several situations where we've participated in the IRS and DOL correction programs in regards to retirement plans or welfare plans. And so we'll talk about that program, our experiences with it, and then cover some of the areas, the more common errors that we see that get people in a situation where they have to be involved in one of the correction programs. So we hope that that'll be helpful to the attendees with dealing with the sticky issues about compliance in regards to retirement plans and welfare plans. It's an issue. It's one of those sleeper issues sometimes for clients. So we hope y'all we hope you'll join us, and we hope you'll always give us ideas about what you want to hear. We're always open to suggestions. We want to talk to you about things that you want to hear about. So Demetrius, you have anything else you want to add?
I don't. There's my contact information. If anybody has any questions with regards to anything that I talked about, please be on the lookout. If that temporary emergency standard is issued on March 15th, we will definitely have a blog post ready to go to advise if there was any changes to the standards that might have deviated or differed from the guidance that came out on January 29th. If it looks a lot similar, you'll see that as well in the article. But I just wanted to let everybody know if it does come down at or before March 15th, we will definitely have update for on our blog, scemployersblog.com. Shameless plug again. Thank you, everybody. Thanks, Chris.
Thank y'all.
Thanks for joining this webinar presented by Hainsworth Sinclair Boyd. To learn more about the firm and its services, visit hsblawfirm.com.